Hi, Lance Walker here at the Michael Johnson Performance Center, talking a little bit about the relationship between hip mobility and knee stability. Using whole body vibration, the Zen Pro, we're able to train both of those components in an isolated fashion and then begin to reintegrate those two together to produce a nice amount of stability across the knee and the closed chain, while we impart great hip extension, hip flexion patterns through huge mobility in the hip. Key components to that is the balance between the two. Too much of one and not enough of another can cause problems. A lack of hip mobility, we feel, can contribute to compensations at the knee, causing or precipitating knee instability. So the focus for us is a bias towards hip mobility and a bias then feeding knee stability, specifically in the closed chain. Components that can feed that with whole body vibration are resetting some of the muscle tendons, some of the Golgi tendons, some of the spindles, the things that are involved with these co-contractions that are happening at the knee joint, as well as allowing for fluid transition from hip extension to flexion and symmetrical hip flexion extension separation at the hips. Without whole body vibration, it's a crapshoot whether or not your body is actually using the right motor patterns to create those movements. Also, whole body vibration, we found, does a great job of busting through some plateaus where maybe a therapist or another practitioner has had issues creating some of these symmetries or some of these balances between mobility and stability. Specific whole body vibration training using hip mobility sequencing as well as knee stability progressions are a great way to enhance not only your athlete's performance on the field but decreasing their risk potential.